Good morning. This is Jessica Wooten, FNP student, providing verbal dictation for nursing 5830 on patient AB. Date of birth is October 1st, 2015, and he was seen in clinic at Pineville Children's Clinic on the date of April 6th, 2017, with the preceptor, Dr. Vergava. AB is an 18-month-old Caucasian male who lives in Pineville, Louisiana with his parents. He is insured by private insurance through Blue Cross Blue Shield of Louisiana. He is accompanied today by his mother. Chief complaint is nasal congestion for 3 days. The child has no known drug allergies. He has nasal drainage for 3 days as well. The drainage is clear. Mother reports his allergies have been acting up for about a week. He continues to take over-the-counter Zyrtec at 2.5 milliliters a day. Mother reports that a cough for 2 days that started off wet and is now improving and drying up. Mother states that he just doesn't act like he feels very well. She denies any history of trauma, headaches, denies any signs of eye pain, itching, vision changes. She denies any signs of ear pain, hearing problems, throat pain, difficulty swallowing. She also reports that he doesn't have any signs of shortness of breath or dyspnea upon exertion or any pain or swelling to his glands. No other close family members are reported to have similar symptoms, but many children at the daycare have been diagnosed with upper respiratory infections and strep throat recently. The mother reports she was ill with a cold a couple of weeks ago. Again, current medications include the Zyrtec at 2.5 milligrams daily. Past medical history does include seasonal allergies, which he's on the Zyrtec for. No surgical history. Pertinent family history includes mother, maternal grandmother, maternal grandfather, all living without medical problems. Father, paternal grandfather, and mother, grandmother living without medical problems. Mother denies any family history of heart disease, diabetes, coronary artery disease, psoriasis, or atopic disorders. Social history, he does live with his mother and father. He has no siblings in the home. He does have frequent contact with a 22-month-old male cousin. Maternal tobacco use is reported, but she says they do not smoke in the house and or the car. She denies any illicit drug use within the home, reports minimal alcohol use, 1 to 2 8-ounce drinks twice a month. The child does ride in a rear-facing car seat at all times. He attends daycare while both parents work full-time. Extracurricular activities include frequent outside play with observation. Of note is that the child did report to the clinic without shoes. She says he wears shoes, no shoes most of the time. Review of systems. Mother reports, again, the child is not feeling very well, positive for malaise. She denies any fever, chills, night sweats, changes in appetite, or weight changes. Um, Pertinent cardiac history. She denies any signs of chest pain, palpitations, or dyspnea upon exertion. Denies any pain, tenderness, nausea, vomiting, diarrhea, and constipation. Um, Also negative for any signs of joint aches, stiffness, weakness, or muscle cramps, rashes, or itching. And denies any signs of weakness or psychological changes. Objective data includes vital signs: blood pressure 92/54, pulse 140, respirations 30, temperature 98.7, pain at 0, weights 26 pounds, height is 33 inches, and current BMI is 16.8, so he's 75th percent on the growth chart for height and weight. Physical exam reveals well-dressed, well-nourished Caucasian male, no acute distress, and he is ambulatory. HENT evaluation, normal cephalic, atraumatic head, eyes are PERRLA, no lid lag, nystagmus or strabismus noted. He had a little conjunctival erythema to the right eye toward the nasal aspect. External ears were non-tender without erythema. Tympanic membranes were intact bilaterally. No erythema. Light reflex was present on the left, however, distorted on the right, but that was due to a partial occlusion with cerumen in that right external auditory canal. Nares are patent. They were erythemic and swollen. The oropharynx was pink with clear mucus and no lesions or vesicles noted. Pharyngeal cobblestoning was present. Tonsils were at +1. Mucous membranes moist. Neck supple. Lymph system, no palpable supraclavicular, inguinal, cervical, or axillary lymphadenopathy present. Cardiac, regular rate and rhythm, no murmur, capillary refill was immediate. Respirations, his lungs were clear to auscultation bilaterally, no retractions or adventitious sounds, no signs of labored breathing. Abdomen was soft, non-tender, non-distended. Bowel sounds were normal active and without signs of hepatosplenomegaly, no palpable hepatosplenomegaly. Musculoskeletal range of motion was not assessed. However, muscle tone was appropriate for age. His skin was clean, dry, and intact with no rashes. Turgor was in normal limits. Neuro, no tremors. Gait was normal for age. Hearing appropriate for conversation. And psychological eval, he was alert. His affect was appropriate, and he responds appropriately to questioning. Medical assessment includes medical diagnoses of upper respiratory infection. Differentials. I want to back up there. Medical diagnosis of upper respiratory infection with positive symptoms of nasal congestion, brief onset of illness less than 10 days. He didn't read positive symptoms of recent exposure, clear nasal drainage, history of allergies, the pharyngeal erythema, and the erythemic swollen nares, as well as the complaints of malaise. And no, the negative symptoms on that were conjunctival erythema, which brought on the secondary differential of allergic rhinitis. However, negative case data on that, there was no periorbital swelling, my apologies. The nares were erythemic, swollen. He's 18 months old, and literature, as quoted in Burns, indicates that allergic rhinitis is not common under 4 years of age, if I can remember correctly. Again, negative case data for allergic rhinitis. The nares were erythemic and swollen, not pale and boggy, and tonsils were not enlarged. Another differential included acute sinusitis, in which we did a CBC, and the CBC was indicating a viral infection, which leans more towards upper respiratory infection. Again, the duration was less than 10 days. He had no facial swelling or tenderness, no mucopurulent sputum. Mucus was clear. However, he did have the nasal congestion and the erythemic swollen nares and pharyngeal erythema. But the flu test, so when we started looking for causes of URIs, flu test was negative, and he was afebrile, and he didn't report, or the mother didn't report, any myalgia or anorexia, no changes in appetite, no sore throat. And the strep throat, we checked for that, and case data was again negative. The rapid stress test was negative. He was afebrile. There was no tonsillar exudate and no palpable cervical lymph nodes. The plan of care, diagnostics included, as Steve stated previously, was the rapid strep test was negative, the flu test was negative, and the CBC showed an elevated lymph and monocyte number, but a normal WBC. Therapeutic plan involves symptom management with Mucinex at a third of a teaspoon every 6 hours, Tylenol at 2.5 milliliters every 4 hours as needed should fever appear. Encouraged fluid intake, including up to 3 cups a day of fluid, and advised them to hold the Zyrtec right now, as antihistamines may make the mucus thicker and harder to clear. Teaching and counseling, report back to the clinic if symptoms do not resolve or if fever gets, or if high fever or ear pain occur. Also, let us know if the symptoms improve and then return. It'll right back around. Follow up as instructed above and with routine visits due at 24 months. Level of billing with CPT code 99214 as indicated by Bupert. Framework application. Positive symptoms, case data include he was current on his immunizations for his physiological variables within the advanced practice nursing framework. What negative case data physiological was the nasal congestion, seasonal allergies, and possible exposure to secondhand smoke. He also had the interpersonal negative data of daycare exposure and extrapersonal of the time and expense for appointments. Positive data in that area included they do have health insurance and transport to medical care. Pertinent psychological stressors include the parent's uncertainty about what the child needs to improve the current illness. However, on the positive extrapersonal end of that, they were able to empathize and relate to how the child feels, so give some good support. There was a positive relationship with the parents as well as family members and the daycare. Negative sociocultural data did include exposure to tobacco use and the effects of the daycare relationships due to illness. Planning. AB will have a resolution of symptoms within 5 days' time. If he complies with recommended treatment regimen, symptoms should resolve. If symptoms don't resolve, reevaluation is indicated. Interventions were mentioned previously. The CBC rapid stress and flu tests were all secondary interventions related to direct clinical practice and evidence-based practice. Therapeutic interventions, such as the symptom management, were secondary interventions related to direct clinical practice. The teaching and counseling involving common causes of respiratory infections, the appropriate dosing of Mucinex and Tylenol, advising rest and oral fluid intake were secondary interventions related to guidance and coaching. Avoidance of secondhand smoke, again, secondary, applicable to the guidance and coaching. Discuss methods to prevent infections, such as stressing hand washing, secondary intervention, guidance and coaching, and encourage routine vaccinations and annual influenza vaccines, guidance and coaching, secondary intervention. Evaluation, no follow-up is indicated until routine evaluation. If symptoms get worse, new symptoms develop, or the illness seems to return, a reevaluation will be indicated at that time. Thank you very much.